3 years on, and millions are still dealing with COVID, not just physically, but emotionally too. In fact, as we're about to see, the numbers of depressive or anxiety disorders are staggering.
That's right. Dr. Jessica Britt Thomas is Director of Integrated Behavioral Health in the Department of Family and Community Medicine at MCG Wellstar, and she's joining us again this morning to talk about this topic and what can be done. Dr. Jess, it's good to see you.
Good to see you guys again.
Let's talk about the rates of mental health conditions. What are they following COVID, or the impacts of it?
The impacts. So there were quite a bit, but what we noticed is that, and there were a couple, so what I'm talking about today is from the National Institute of Health, and also CDC did a Wander project. And they found, particularly in the United States, that there was a 5% increase from the start of COVID to immediately less than a year after. And the rates have been trending around 32%. So there's been an increase in reports, particularly around anxiety and depression. Worldwide, we actually saw a 25.6 increase, which is pretty big. It doesn't sound like a lot, but worldwide, that's quite a bit. And they found correlations to individuals who were either seeking job, loss of job, young adults and women were ones who were reporting a significant emotional increase since COVID.
Wow, just shocking numbers and information there. So when we're looking at COVID, what impact did it have on social interactions and SAD?
Yeah, so social anxiety disorder is a mental health condition, right? It's marked by intense anxiety or fears in a social setting, and there is a perceived negative threat, right? You have a perception that you're going to be perceived or judged in a negative way, so you just outright avoid. So think about COVID, right? What happened? Quarantine, lockdowns, work and school closures, social distancing, avoiding non-essential kind of social interactions. So all of that fueled that avoidant behavior and actually increased rates of symptoms compared to those who did not. So in other words, people who were already dealing with social anxiety prior showed a spike in their symptoms during COVID versus those that did not. We also found those who were not being treated. So they weren't actively working with a provider, taking medication, whatever it may be. Right. They were not involved in treatment, also showed an increase since the pandemic in terms of their symptoms.
Let's talk about the transitioning to post-quarantine, the impacts on your social anxiety. You're finally getting back out and you're maybe starting to take out that mask, but there's always that thing in the back of your head.
Yeah, we all thought, hey, this is a great idea. We're getting back to normalcy. No. It was actually a lot stressful for people because we had isolated for so long. We had been told not to interact, and now we're interacting. What do you do? So we found that those who were kind of distancing or engaging in virtual kind of email, they call it character communications, they struggled a lot more with the restrictions of COVID. We also found college students in particular who just went right back into a high frequency of social engagement, struggled in terms of just dealing with acute symptoms, the daily routines, and not understanding how to kind of re-socialize or reintegrate. A lot of that was due to perceived threats of contracting COVID, giving it to someone else, and then just really losing the social etiquette of how do I interact with someone? How do I have a conversation again? Social distancing. How much time do I need to spend between, interacting with others before it's okay? So it was a challenge for a lot.
Huge impact that we probably didn't even think at the time was going to happen, right? Are there any positive implications, though, of COVID-19 on mental health and treatment?
Yes, so we actually found some really good things that are still happening presently. So the first thing is we actually had a policy change. So there was, for instance, here at AU, all of us are licensed here in Georgia. We were able to provide services to patients that were across the border, so South Carolina in particular, versus having them have to come in. And so that was one thing that was really helpful. That also kind of cultivated the growth of telehealth and telemedicine, if you've heard of that or if you've experienced it yourself. That used to be, it's always been around, but it used to be something that was seen as a last resort. You didn't do it as much. And now it's becoming just as popular, if not more, than in person. So you're seeing those being offered now that's still here today. The invention of the crisis line 988, that did not exist until 2 years ago. That was directly due to COVID and finding ways to reach more people from a distance. School-based policies around focusing on preventative care, early detection, again, that was out of COVID. And then particularly with substance use treatment, finding more ways to be accessible, mailing in medications, having mobile clinics versus having to have the patient come directly to the clinic itself. So a lot of good things.
Let's talk about some resources really quick for people that would like to get some more information on this.
Yeah, so the main kind of resources are the World Health Organization, the National Institute of Health, and then the CDC are all pioneers. Also the Mayo Clinic, if we put that on there as well, are all pioneers in providing guidelines with kind of how to readapt to COVID-19, talking a little bit more around social anxiety. That's definitely worth a read.
All right, good stuff to check out. And obviously, it's something that affects, again, millions and millions of people worldwide. Dr. Jessica Britt Thomas, thanks so much.
Thank you so much.
Appreciate it.